What are drug-eluting stents? How do they help prevent heart attacks and save lives? I'm wanting to give you a brief introduction to drug-eluting stents and how they can improve patient outcomes. Over this next few minutes, I want to cover with you what a bare metal stent is, what a drug-eluting stent is, and the difference between the two, how drug-eluting stents are deployed, and how patients can greatly have improved outcomes by using this type of therapy. Stents are really very similar to this spring, which I just pulled out of the ink pen, which once my wife finds her spring gone out of her ink pen, she's going to be mad. But this is very similar to what you would see as a drug-eluting stent. It's very similar in size once deployed and length. The length of the drug-eluting stents could be anywhere between 7 to 28 millimeters in length, and the diameters will vary just depending on the actual patient and what's needed at that certain time. But it kind of gives you a really good physical visual representation of what a drug-eluting stent might look like. So this would actually go into the coronary arteries. It would be inflated, and this is what would be left behind to help the blood flow through the coronary arteries. Another representation of that is this picture right here. There's three parts to the drug-eluting stent. There is the guide wire, which runs the full length of the stent. You have the balloon, which is a clear part here, and then you actually have the bare metal stent, or the drug-eluting stent, which is mounted onto this balloon. The guide wire is run up into the cardiac arteries. The balloon is inflated. Then you have the stent that will expand. The balloon is then deflated. Everything's taken out and just leaves the stent behind, and that is what is left in place to keep the arteries open, push plaque away, and help bring the blood flow back to the heart, to that part of the heart that was potentially damaged. Another representation of this from angioplasty.org website is all this area right here. The yellow area is kind of the plaque buildup. That's from the years of fried chicken and apple pie and not enough exercise. That's what happens. You get this plaque buildup into your arteries, and so the blood is not able to flow. The guide wire with the balloon and the stent is then run through the length of the lesion, which is what this part is called, and then the stent is expanded. And then when that drug-eluting stent is expanded, again, the balloon and the guide wire is pulled out, and then the drug starts to actually go to work. The drug that is put onto this stent could vary from stent to stent, just depends on the manufacturer and the type of drug that they use on their stents. The actual stent, and this is a great picture from the American Heart Association. This gives you a microscopic view of what a drug-eluting stent looks like. This is the actual metal part of the stent itself, and then you see the microscopic drug that is placed onto the stent, and this is put on there with this polymer coating, which allows for the drug to elute into the system over a period of time. It doesn't go right away. It's not like a shot in a vein or something similar to that. It kind of just melts away over a period of time, so it gives the system, the patient system, this drug over an extended period of time, as opposed to an immediate injection, again, like into a vein. The amount of time it takes for that drug to fully wear off of that stent could vary anywhere between 7 to 28 days, just depending on the patient and the type of drug. As we talk about the deployment of the drug-eluting stent, again, we have the vessel here, and then you have the lesion, the plaque buildup, and the guide wire and the balloon with the stent. That is all run to make sure you have good coverage of the full lesion. The balloon is then inflated. It's inflated with air just like any other balloon would be. And when that happens, you can see the stent and all of its interlocking pieces. The stent will then expand, and it will brace itself up against the wall of the vessel, pushing the plaque out of the way and allowing for a clear passage. As you can see below, when the guide wire is pulled out, a clear passage for blood to flow. When that blood starts flowing back, it then starts feeding the heart again, and the heart muscle can continue living, continue pumping, and presenting itself as a healthy patient. Some some really great examples, some great pictures of before and after. This is very telling of what drug-eluting stent therapy can do for you. On this picture here, you see an actual blocked artery. So all of this dark area here is blood flow. And you can see blood is coming through here. This would be part of the descending aorta into the cardiac arteries. This would be the heart. And this whole section right here is not getting any blood flow. So you hear about 70%, 80%, 90% obstruction. This would pretty much be a 90% obstruction, or maybe even more than that. But they'll take this part and they'll insert the drug-eluting stent. And the drug-eluting stent, you can see, has been placed right here. And you can see how wonderful of a job that does, is allowing the blood to flow back as it's intended to. And it feeds all of this heart muscle. And when that heart muscle gets the blood, then it will continue beating and living and being healthy. When you start feeling that pressure and start feeling that tension in the heart, that's when you know you're having heart issues, heart problems, and the heart muscle is dying because it's not getting enough blood. The benefits of this therapy are numerous, but some of the biggest benefits are you almost get an immediate resolution to your symptoms. Blood flow starts back, heart muscle gets healthy again, and the patients typically are feeling better almost immediately. There is a very short recovery time and a back to normal time, as there's very small incisions made in the femoral artery, as well as there's not a lot of trauma to any other parts of the body, so you don't have that that concern that you might have had several years ago when you had an open heart surgery just because of these clogged arteries. The therapy is relatively new on the grand scheme of things. It's only been around for about 15 years or so, although bare metal stents have been around since the mid-1980s. But this, as we've talked about, is a much more affordable, it is a much easier, a less traumatic way to get this therapy that is needed. And I hope that you see that, as we talked about, what a stent is. We talked about the difference between the drug-eluting stent and the bare metal stent, and either one of them might be a benefit to you. And you kind of get an understanding on how stents are deployed and how possibly good of a therapy this could be for you. I hope you'll understand that if this is something that you need, and hopefully you never do, that you will contact your doctor and your cardiologist and have them make a decision based on your current medical history.